First of all, I want to welcome this new important initiative and celebrate the launch of the new centers in Athens and Thessaloniki, which aim to provide valuable psychosocial support for workers in Greece. Protecting the physical and mental health of workers is a core value of the ILO since its foundation in 1919, and its importance was strongly reaffirmed this June 2022, when the International Labour Conference declared a safe and healthy working environment as a fundamental principle and right at work. Mental health at work has a huge impact on society and the world of work, with 12 billion working days lost every year due to depression and anxiety. Poor mental health can further influence physical health, as it can increase the risk of accidents at work. The COVID-19 pandemic exacerbated many risks for workers, with particular impact on workers' mental health, and it reminded us of the importance of addressing mental health in the workplace. Many workers faced unemployment due to the crisis, and countless others struggled with increased job insecurity. Job insecurity and economic vulnerabilities can have substantial negative impacts on mental health and well-being, leading to increased stress, anxiety, and the risk of mental health disorders. For those workers in the informal economy, casual workers, and gig workers, these risks can be even higher. Furthermore, when workers are afraid to lose their job and income, they may be reluctant to speak out about their concerns, including concerns related to safety and health at work. They could also avoid taking sick leave, leading to physical and mental health impacts. The COVID-19 pandemic also put a spotlight on work-life balance, as large numbers of workers shifted to working from home and often found that boundaries between work and personal life can become blurred, resulting in possibly negative consequences for well-being. Workers were often expected to have constant access to their email, even outside of working hours. On the other hand, violence and harassment in the workplace also impacted workers in nearly all sectors. For those in healthcare and emergency services, they often faced physical violence and verbal threats due to anger in communities over the crisis. Those teleworking and working from home also faced the threat of cyberbullying and other virtual types of harassment. As we are slowly moving into the future, beyond the COVID-19 crisis, these risks and many other psychosocial risks continue to pose a threat to our workers worldwide. Moving into the future, a changing world of work with increased working from home and digitalization means that these risks, if not appropriately managed and controlled, will likely increase, as well as be met with additional unforeseen risks. In response to this, the ILO and the WHO recently developed a joint policy brief on mental health at work, calling for action on mental health in the workplace and promoting a comprehensive approach that covers the prevention of psychosocial risks at work, protection and promotion of mental health, as well as support for those living with mental health conditions. It is important that an enabling environment is created to improve mental health and that adequate support is provided to those workers experiencing mental health conditions. Starting with prevention. A preventative approach towards psychosocial risks and mental health at work should be built on sound risk management. Employers should identify all existing hazards and assess the associated risks. Open communication between employers and workers about risks in the workplace can ensure that workers are engaged in preventive efforts and informed about potential risks. The potential sources of stress should be identified, including those psychosocial hazards that may arise due to OSH measures and new work processes and arrangements adopted to control other risks. This has been particularly relevant during the COVID-19 crisis, where measures to control the spread of novel coronavirus may have created new unforeseen hazards. In contexts such as the COVID-19 pandemic, external factors affecting mental health and well-being should also be considered, such as fear of being infected, fear of losing one's job, seeing revenues reduced, fear of experiencing lower quality of life, social isolation, and the weight of domestic responsibilities being increased in the absence of schools and services. Speaking about promoting good mental health and well-being can not only reduce the risk of workers experiencing poor mental health, but can have positive impacts on productivity. Encouraging healthy habits, such as good nutrition, physical exercise, sleep, and social connections, can help to create an environment that is conducive to positive mental health. When workers are part of an enterprise that values a positive OSH culture and prioritizes their physical and mental health, work can also have positive impacts on their mental health, providing a sense of purpose and community. Finally, support. It is important that workers can access support systems for their social and psychological health to ensure that workers are not isolated and that they are able to access appropriate help, leading to a quicker recovery and return to work. Initiatives such as the launch of the psychosocial support centers we are celebrating today are a very important step toward making this a reality. I thank you again for inviting me to speak today, and I look forward to hearing the impact of these new centers on workers and the community.